Signs of unhealthy baby in the womb. Miscarriage is one of the common consequences of an unhealthy baby, resulting in loss of pregnancy before the 20th week. We cover some of the warning signs in this video. During the 5th month, a fetus becomes more reactive towards sound, light, and pain. This is a period when they are also exposed to various threats that may affect growth and development, directly or indirectly. Here we discuss some signs of unhealthy fetus. Abnormal fundal height. Fundal height helps the doctor evaluate whether a woman's uterus is growing or not. If the height of your uterus is not what it should be, it indicates a problem with your pregnancy. The reason may be too much or too less of amniotic fluid or a breech baby. In the worst case scenario, it could also mean that the fetus is not developing in a proper manner. Lack of or no heartbeat. Although a baby's heart starts beating after the 5th week, it's only around the 6th week that detection becomes easy. At times, detecting the heartbeat may not be possible due to a change in the baby's position or placental issues. In such a case, your doctor might ask you to try again during your next visit. However, if she still can't detect the fetal heartbeat, then an ultrasound test might be recommended to dig out the reason behind the undetectable heartbeat. In some cases, lack of heartbeat signals a hindrance in fetal development or in worst cases, a lifeless fetus. Low hCG level. hCG is a type of hormone produced by the placenta during pregnancy. hCG levels tend to fluctuate throughout pregnancy, depending on the trimester. Generally, hCG levels are extremely high from 9 weeks to 16 weeks of pregnancy. The normal levels vary from individual to individual, so a low hCG level is not a reason for you to panic. However, miscarriage, a blighted ovum, or ectopic pregnancy may induce a low level of hCG and raise a red flag for your pregnancy. Excess cramping during pregnancy. Pregnancy comes with its share of pain and aches. However, extreme pain, which feels like menstrual cramps, is another warning sign. In early pregnancy, if you feel excess cramping, you might need to consult your doctor. Bleeding during pregnancy. Spotting during pregnancy is not normal. However, bleeding is still a matter of concern without a doubt and needs to be evaluated by a doctor. It might be a sign of miscarriage, hormonal bleeding, or implantation bleeding. Extreme back pain. Experiencing back pain is common during pregnancy as the growing baby puts a lot of strain on the spine and lower back. This feeling worsens when you are expecting multiples. Well, look out for back pain which becomes severe as opposed to a dull ache in the back. Also, if it starts from the front of your body and makes its way to the back, it's not a good sign. You should visit your doctor immediately. Vaginal discharge during pregnancy. Usually, the vaginal discharge of a pregnant woman is clear, transparent, whitish and odorless. However, if you notice a yellowish or greenish discharge with a strong smell, then it's time to consult your doctor without any further delay. The unusual discharge might be caused by cervical inflammation, a sign of miscarriage. Sudden discontinuation of morning sickness. Usually, morning sickness resolves itself by the end of the first trimester or even earlier without affecting the fetus. However, for some pregnant women, sudden discontinuation of morning sickness might be because of low hCG levels, pointing to a miscarriage. It's advised to seek an expert's opinion and make sure there's no threat to your baby. Fever during pregnancy. Fever during pregnancy should not be ignored. A fever might pose the threat of a bacterial or viral infection to the fetus. No fetal movement. Fetal movement can be felt around 20-24 weeks in first-timers as the fetus starts reacting to sound, light and pain. Experts say that a pregnant woman should experience at least 3 kicks every hour during this period. If the fetus is in distress, the count declines. It's a clear sign to consult your doctor for proper treatment. Any delay in seeking medical help might cause an unfortunate event. Contraction of breast size. During pregnancy, the body of a woman goes through a multitude of hormonal changes. Breasts go through a transformation and become more sensitive. They also feel heavier and fuller as the pregnancy progresses. However, a sudden decrease in the size of breasts may signal a miscarriage. Sudden spike in blood sugar levels. It's normal for blood sugar and blood pressure levels to decrease during pregnancy. In fact, you should keep these levels throughout the 3 trimesters. However, diabetes can cause sudden intrauterine death and raised blood pressure can cause premature separation of the placenta. Changes in placental position. An abnormal placental position is also one of the signs of an unhealthy pregnancy. When the placenta detaches prematurely from the uterus, the pregnancy gets terminated. So, always get your placental position checked. Intrauterine growth restriction, IUGR. Intrauterine growth restriction interferes with the growth of the fetus. If you are diagnosed and have IUGR, it implies that your fetus measures at least 10% smaller than its gestational age. If you're suffering from IUGR, complications, such as difficulty in breathing and high blood sugar, may be the cause and continue even after delivery. This problem happens due to abnormal functioning of the placenta, which in normal conditions ensures the baby gets all the necessary nutrients. Other reasons include kidney issues, anemia and diabetes. Subscribe for videos and press the bell icon to get the notification of all upcoming new videos.